Good evening. My name is Lakeisha Sutton. I am a first-year student in the Social Work Master's Program at Jackson State University. Today I will attempt to produce a YouTube video of my research proposal for my research methods class. In this video, I will give an overview of my topic of choice and discuss briefly the format of the research proposal. The topic I chose is dealing with ADHD and the impact that it has on children that displays off-task and disruptive behaviors in the classroom. ADHD basically is a medical condition that is treatable, treated with medication, therapy, or however you see fit that the individual will be able to sustain the symptoms of ADHD. The title of my research is The Impact of ADHD and Off-Task Behaviors in the Learning Process in the Classroom. Will interventions help? First, a little history about ADHD. ADHD is a treatable medical condition that at this time does not have an exact cause. ADHD is short for Attention Deficit Hyperactivity Disorder. Over a period of time, the diagnosis has become complex and specific. The number of school-aged children diagnosed with ADHD has increased according to the CDC, Center for Disease Control. Symptoms of ADHD are inattention, impulsivity, and hyperactivity. Children can experience all three of these symptoms or have periods where they are experiencing one or the other. However, these symptoms cause problems for children while at school, and it interferes with the learning process. The statement of the problem. Each day children are being diagnosed with ADHD and their progress in school behavior starts to change. Children that display off-task behaviors and that are disruptive in class can interventions help to reduce their behavior? If so, which ones and how? So to reiterate the problem is that we have kids who display various behaviors in the classroom that are basically symptoms of ADHD. How could you help the child to become successful? What resources, what can you use to support? What will help to make the learning process better for the child? The significance of this study is to find out from teachers and students what will work best to help curb the off-task behaviors so that the learning process will not suffer. Also to find out what strategies and support need for teachers to help individuals succeed. While conducting this study, I found a few articles that were very informative on this topic. The first article discussed effective classroom interventions on off-task behaviors. It was conducted at the Department of Clinical and Developmental Neuropsychology in Germany. The study was a meta-analytic study that determined the effectiveness of several types of interventions. The review consists of 76 single design researches that measured the effectiveness of interventions given by teachers. The second order was a study entitled Helping Students with ADHD in Classroom Strategies for Teachers. The article highlighted some interventions that could help to decrease off-task behaviors that stop the learning process. The article was very detailed as to how to implement each intervention and possible outcomes. Can't read my own writing. Two general questions that pondered me were for this research was one being what behaviors are displayed the most among ADHD kids? What behaviors do teachers notice most with ADHD kids? What are some interventions tested that can possibly help with these behaviors? The reason for this question is, what are some interventions that could help with students who are diagnosed with ADHD? How could they be used to help the teacher help the child in the classroom and learning process? Methodology used. The research methodology. This study was designed to research different behaviors and interventions that can help to decrease those off-task behaviors experienced by teachers in the classroom with students with ADHD. The study included conducting interviews and surveys from teachers and parents of individuals with ADHD. In this study, there are 100 participants, all elementary age kids ages 6 to 12. They are attending the same elementary school. The teachers were interviewed and asked about 20 to 25 questions as they relate to the behavior of individuals that they have observed in the classroom setting that causes the individual to miss out on instructional time. We were also asked to provide two hypotheses. My first hypothesis is if students were giving interventions, their behavior would decrease. The second hypothesis is if teachers are not aware of interventions, the individual will continue to struggle and not be able to learn in the classroom. Independent variables, students without interventions. Dependent variables, students with decreased behaviors due to the interventions. A qualitative research with a single subject design. I chose this topic because I have a son who's diagnosed with ADHD, and I noticed that from over a period of time, his behaviors changed, and he had a different experience each year as he matriculated through elementary school. Right now he's 4th grade. So starting at kindergarten, his symptoms were the inability to sit still. He could not, his attention span was very short. And now he's going to be more hyper in the classroom, which I thought it would have been reversed. He would have been more hyper in kindergarten than he would be 4th grade. But however, just recently I've started to look into some intervention and resources that the teachers in school could possibly use to see if that would help with his learning process in the classroom, to see if he would benefit from interventions that will cause him to decrease off-task behaviors and not be so disruptive in class. What I think I am learning most, or have learned most with this research, is that some interventions work and some don't. You just really have to find what will work for that particular individual. Not all interventions will work with the same kids. So that was the purpose of the study, was to see what interventions would benefit the child and would it have a lasting effect on the individual as they progress on through later years in school. Some of the interventions work, some don't. But as I continue with the research and complete this proposal, I hope to have learned and gained what actually would work for individual that displays these symptoms of ADHD. I hope that this was helpful, and I hope that it was knowledgeable to my classmates. And if you have any questions, please feel free to send me a reply, and I will be able to answer any questions that you have. Again, this is my first time doing a research proposal, and it's okay. And I think it also would allow me to be able to become more knowledgeable of the research. And thank you.